Across to Gautam Menon to try and see if he can help establish what may happen next. You know, given all the modeling that you do, if people continue to behave this way, where do you see the COVID graph go? We're already seeing in a state like Kerala some shoots of another uptick in COVID numbers. The reproduction number is about 1 now. How alarmed are you by what you're seeing? If things continue this way, where could we be in a few weeks from now, Gautam Menon?
I agree with Dr. Prehan that it's social factor that will really determine what's going to happen in the next few weeks. I expect that this will lead to some level of uptick in cases, especially in the north, where your visuals showed that. But I suspect that overall, this will not lead to a third wave, certainly as substantial as we saw in the second wave, which swept across India from about the middle of February till barely about a month ago. I would be concerned about states like Kerala, which really never, if you look at it, it's Kerala, Manipur, Tripura, Arunachal Pradesh, Mizoram, Sikkim, which are still showing test positivities in excess of 10%. And over there, it's as though the second wave never really completed. And these are the states that I think
Why is that? Some of these states seem to be stubborn, a Kerala or a Maharashtra, where the second wave never crashed in the way that it did in some other places. Is there a way of knowing why that's the case in your view?
I suspect that Maharashtra is probably now coming down. The numbers are going down. It's Kerala that I would be a little more worried about. And in my opinion, it's likely that Kerala managed this pandemic a little better than the other states. So overall, there were fewer people infected and therefore more people potentially susceptible. And I think it's this combination of a relaxation of norms that exist, plus the fact that there are more people, a significant fraction of the population is potentially susceptible, that you're seeing this reason why Kerala numbers aren't really coming down. I suspect that the Northeast as well may have some sort of similar behavior, as well as the fact that they lag, in a sense, central India, the bulk of India, by a little bit, maybe by about a month and a half in terms of their cases. So I would watch out for the Northeast, I would watch out for Kerala to see what might happen. But I'm reasonably sure, to whatever extent, that across much of India, much of central India, north, south, west, we will not see a wave of the size that we saw in the second wave.
No, sure. So the second wave was a tsunami. It doesn't need to get that bad. But how bad can it potentially get? Because what's happened between the start of the second wave and now is that more people are infected, so they have some antibodies, more people have jabs, so they have some kind of protection, but it still could get bad. Is that something that you're concerned about, Gautam Menon?
I would be most concerned about new variants, because I think with the existing variants, given that so many people have been infected already, and the fact that many people have already been vaccinated, let's say 38% of our population have at least one jab, I would be I really don't think that the third wave will build up to that level or build up that fast. I would worry about people who have not been vaccinated yet. I would worry about the elderly who have not received their shots so far. I would worry about the immunocompromised who have not received 2 doses of the vaccine. These are the people who are potentially vulnerable, and these are people who could potentially contract the disease if we aren't careful. And that's still a large factor.
Dr. Maninder Agarwal.